Hi all, welcome to Nidin Saran Training. Today we are going to discuss about developmental dysplasia of hip. So what is developmental dysplasia of hip? From the name itself, it is something related to improper development of hip after the birth of the baby. Actually during the embryonic stage of development, that means inside the womb itself. Every baby's hip joints will be molded into the acetabulum or socket. But in some baby, there will be improper development of hip into the acetabulum. So it can lead to some dislocation. So let me discuss about the classical features of developmental dysplasia of hip. We can see shortening of affected limb. Which hip they are having this problem, that hip will be shortened, that limb will be shortened. Second sign is uneven gluteal fold is seen when you place the baby in prone position. When you place the baby in prone position, there will be uneven gluteal fold. That means there will be some foldings in the buttocks. So third classical feature, we can go for Barlow's test and orthogonist test. What is Barlow's test? In Barlow's test, we want to flex and adduct the hip. When you flex and adduct the hip joint will be displaced from the acetabulum or socket, and the examiners may feel that the hip joint is out of the acetabulum. That is what we call as Barlow's test. But it is not a conformity test. The conformity test is orthogonist test. That is the second test. In this test, we will be flex and abduct the hip. Abduction means moving away. So when you flex and abduct the hip, we can see that the dislocated hip joint will be safely placed into the acetabulum or socket. So we can hear some audible clunk sound. There will be audible clunk sound when the hip joint will be placed into the acetabulum bag. This is what orthogonist test. So these are some of the classical features of developmental dysplasia of hip. Let me discuss about the management. From birth to 6 months, Pavlik harness splint is applied. So what is Pavlik harness splint? What is the advantage of this splint? When you apply this splint, it will not provide a rigid immobilization like cast. It will be helping the baby to mobilize the hip joint in a specific movement, and it will allow the hip joint will be molded into the acetabulum. So after 6 months, along with the Pavlik harness, traction is applied, and 6 to 12 months Pavlik harness with the traction is applied, and after 12 months surgical repair, that is open reduction or closed reduction surgery with the spica cast is applied. So you want to remember management is splint, traction and surgery. STS. First splint, Pavlik harness splint, then traction, then surgery. So these are the management for developmental dysplasia of hip. So this is all about this topic. See you all with another topic. Thank you all.